Many health coaches can end up feeling intimidated by the idea of approaching a doctor or medical office and beginning a professional relationship. So what advice do you have for graduates to initiate this partnership?
Yeah, and I think, be confident, own what you do. You do play a role, and not to underestimate the role you play. So be confident, not arrogant, and kind of stay in your own lane. Like, don't try to do the work of the doctor. Don't work with them, not against them. And also, don't misinterpret the doctor's, I don't know how to say it, but standoffness, or they don't have time. And so they might be rather abrupt, and people might be intimidated by that because they think, they don't like me, they don't care, they just don't have, they literally don't have time. Even if they really wanted to talk to you, they don't. So it's important not to misjudge that, and just to be patient, and then find the opportunities. And we were talking a little bit about that earlier, about find those opportunities that you can make that connection with the doctor that are not time consuming. And if you can save the doctor's time, you'll have their ear, and they'll be listening to you. Yeah.
And not to take it personally.
Not personal at all.
It's not about us, it's about helping
Exactly.
others.
And you don't need to work with all doctors. They aren't trained in nutrition. And so they don't know health coaches exist largely at this point in time. And so you have to kind of meet them where they're at and see. And there's plenty of examples where they work really, really well together. But it's just a matter of making that connection, establishing that relationship, and then allowing that to grow.
Yeah, that's wonderful. So this rolls perfectly into the next question. What do you think an ideal health coach-doctor relationship is?
I think acknowledging that the value that each one brings to the table and their unique perspective on that. And as I say, not trying to undermine, and communication. So if you are communicating what's expected of you, like any relationship, what you expect of the other partner. So if you're expecting them to follow through, then make it clear as to what each other expects. And then I think really where each party, the doctors and the coaches, get to operate in their own zone of genius. So doctors have access to really expensive and intricate tests that can do some great work diagnostically. And then the health coaches can really do the hand-holding and the support and the nutrition and the guidance that's required to follow through and help the patient and client. So I think, staying in your own lane, basically.
Yeah, and that's great advice, staying in our scope of practice.
Yes,
that's
exactly.
a huge IAN principle. So
yes,
that's
perfect.
a great way to put
and
it
it's
through.
Key.